Hello, I am Dr. Rajita, faculty of NEXTFELLOW. So we shall start with pancreas, which is very important to understand pancreatitis. So we know the pancreas is a long transverse structure, and in adults the pancreas it is a retroperitoneal organ present over the posterior abdominal wall, posterior to the peritoneum, that is it is retroperitoneal. And if you see the length of the pancreas, it is approximately around 15 to 25 centimeters in length, and so the length will be around 15 to 25 centimeters and weighs around 16 to 120 grams approximate weight. So the pancreas is both exocrine and endocrine gland. So the location of the pancreas, it is a retroperitoneal organ present at the level of second lumbar vertebra. That thing to be noted. It is present at the level of L2, second lumbar vertebra. So if you see the parts of the pancreas, the parts it has got the head, neck, body and tail and uncinate process. So these are the parts of pancreas. So head is this one, the large expanded part which is present within the concavity of duodenum, and head continues to form uncinate process which is present behind the neck, and neck is the small constricted area. Then the large body continues to form tail which attaches to the spleen. So head of the pancreas, if you see the head is an expanded part which is lies within the concavity, which is like C-shaped concavity of duodenum, and it is firmly attached to the descending and horizontal parts, that is second part. It is firmly attached to the second part and the third part of duodenum. The uncinate process is projection from the inferior portion of the head of the pancreas. So we can see this process. This is the uncinate process. So this one is the uncinate process, which is present like a incurve reflection of the head, and uncinate means comma like because it is a small projection, and the structures which lie posterior to the head of the pancreas are inferior vena cava. You can see here, this is a schematic image for you all to understand the relations on the posterior aspect. So inferior vena cava it is present, and posterior to the head, and also it is related to the right renal vein. So here is the right renal vein on the posterior aspect, and the right renal artery, and also inferior renal left renal vein as well. So you can see the right renal vein, left renal vein, which are along with the right renal artery, the right side. And we can see the bile duct which is related on the posterior aspect, and crus, right crus of the diaphragm is also related, and the uncinate process posteriorly it is related to the abdominal aorta and crus of the diaphragm. So superior mesenteric artery and vein are related to the anterior to the relations of uncinate process. So here in this image you can see superior mesenteric vein and artery. These structures are present anterior to the uncinate process, and posterior to the uncinate process it is related to the abdominal aorta. We can see here uncinate process, this part is the uncinate process. Posteriorly it is related to the abdominal aorta which lies posteriorly, and also the right crus of diaphragm. So these are the important relations of posterior relations of head and uncinate process. Next, we shall see the posterior relations of neck, body and tail of pancreas as well. So the neck of the pancreas, the structures that lie posterior to the neck are the meeting point of where superior mesenteric vein. So this one is the you can see here, this is the splenic vein, and this is the superior mesenteric vein. We can see here, it is labeled here, superior mesenteric vein, and these two veins joins at the neck. So here the neck is removed at this area to expose the posterior relations. So what you are seeing only the head. So the neck posteriorly it is related to the formation of portal vein, where we see the confluence of superior mesenteric vein and splenic vein. The body of the pancreas posteriorly it is related to aorta. You can see here the red one is the aorta, and it is also related to what inferior mesenteric vein as well, which joins with the splenic vein. You can see inferior mesenteric vein. So these are the structures on the posterior aspect of the body. Aorta, and it is related to inferior mesenteric vein, and left suprarenal gland, left kidney, and renal artery and vein. So you can see this is the renal artery and vein on the left side, and it is left suprarenal gland. It is also related more posteriorly to the left kidney, so left renal vessels. So these are the relations, posterior relations to the body. The tail of the pancreas is related to the splenic hilum. We can see the tail is terminating at the splenic hilum, and also it is related to left flexure, left splenic flexure of colon. So left colic flexure. So these are the posterior relations. I will just repeat. The most important relation is with the neck. So the neck is related to the formation of portal vein, where we see the confluence of superior mesenteric vein and splenic vein. And body posteriorly it is related to abdominal aorta, inferior mesenteric vein. It is also related to left kidney, left suprarenal gland, and left renal vessels, that is the left renal artery, left renal vein. So these are the relations to the body, and tail of the pancreas will go and end up at the hilum of the spleen, and the tail of the pancreas is related to splenic flexure of colon, that is the left colic flexure. So those are the important relations. Next, about the arterial supply of the pancreas. So the artery which supplies the pancreas, we can see it is supplied by the celiac trunk, and from down branches from the inferior mesenteric artery. Celiac trunk, it is the artery of foregut, and superior mesenteric artery, it is the artery of the midgut. So pancreas and duodenum, they are the structures which develop both from foregut and midgut. So that is the reason they are supplied by celiac trunk and superior mesenteric artery. So let's see the flow. So we can see that celiac trunk, so abdominal aorta gives rise to celiac trunk. Celiac trunk will give rise to hepatic artery and gastroduodenal artery, we can see, and common hepatic artery which goes towards the liver and stomach. So now we are interested with the gastroduodenal artery. So this gastroduodenal artery, when it reaches near the head, it divides into anterior superior and posterior superior pancreatico-duodenal arteries, because it supplies duodenum and pancreas as well. So this one, what you are seeing, dark one is the anterior superior, the dotted one is the posterior superior pancreatico-duodenal arteries. Next, from the superior mesenteric artery, that is the abdominal aorta will gives rise to superior mesenteric artery. We can see here superior mesenteric artery will gives rise to anterior, and directly it gives, you can see here, this is the anterior inferior pancreatico-duodenal artery, and the dotted one with the posterior inferior pancreatico-duodenal arteries which supply the pancreas. And apart from anterior and posterior inferior which supply the head and neck of the pancreas, the dorsal pancreatic artery which supplies the body and tail. So dorsal pancreatic artery, it arises from the from the abdominal aorta. We know the celiac trunk. Celiac trunk gives rise to this tortuous artery which is called as the splenic artery, and splenic artery we can see it gives rise to dorsal pancreatic artery. This dotted one is the dorsal pancreatic artery, which supplies the major part of the body and tail of pancreas. So head and neck of pancreas is supplied by pancreatico-duodenal, that is superior and inferior pancreatico-duodenal arteries, whereas the body and tail of the pancreas is mainly supplied by the dorsal pancreatic artery and also the great pancreatic artery, which supplies the body and tail. So great pancreatic artery, how it arises? It arises again from the abdominal aorta, from the celiac trunk, from the splenic artery. It gives rise to great pancreatic artery, which is represented as magna here. So great pancreatic arteries and dorsal pancreas. You can see here, this is the dorsal pancreatic artery. And caudal pancreatic arteries, which supply the body and tail of the pancreas, they are also from the celiac trunk again, that is from the abdominal aorta, celiac trunk. We can see the splenic artery, which caudally terminates here to give the caudal branches. Before terminating near the hilum of the spleen, we can see the caudal branches which are given off, which are called as caudal pancreatic arteries. So this is about the arterial supply of the pancreas. Let's have a look with the venous drainage. The venous drainage of the pancreas is drained by the splenic vein, which is a principal vein. So how it drains? The splenic vein drains into portal vein. So we can see superior mesenteric vein and splenic vein, they join to form the portal vein. So the portal vein, you can see here the portal vein, it forms the hepatic sinusoids once it enters into the liver. So portal vein first divides into right and left portal veins, and after dividing it enters into the liver and it forms hepatic sinusoids, and where the blood drains into the central veins, which is present in the center of each hepatic lobule. And then from the central veins the blood gets collected to the hepatic veins, and by the hepatic veins the blood is drained into the inferior vena cava. So this is how the venous drainage occurs. So venous drainage occurs through the portal circulation. So directly it is not drained into inferior vena cava. Instead it drains into the portal vein. Portal vein divides like a artery inside the liver, and where the nutrients are absorbed by the liver, and then finally the deoxygenated and low nutrients blood is drained into the central vein, and central veins finally drains into hepatic veins, which open up into the inferior vena cava. And superior mesenteric vein also drains the blood of the pancreas, same procedure as the splenic vein. So superior mesenteric vein, the blood drained by the superior enters the portal vein, then hepatic sinusoid, central veins, then it goes into the hepatic veins and finally drains into the inferior vena cava. So points to be noted: superior mesenteric vein and artery are the anterior relations of uncinate process. You can see superior mesenteric vessels, they are related anterior to the uncinate process. We have seen in the previous image also. And next important relation is abdominal aorta lies posterior to the uncinate process. So uncinate process relations are very important. Anterior to the uncinate process, superior mesenteric vessels. Posterior to the uncinate process is the abdominal aorta. And structures immediately posterior to the head of the pancreas are right renal vein. So next to the head of the pancreas, right renal vein is present. Posterior relations of pancreatic head are inferior vena cava, terminal parts of right and left renal veins, and also common bile duct. So those were the posterior relations. And behind the neck of the pancreas, we can see the formation of portal vein. So here is the formation of portal vein, where splenic vein and superior mesenteric vein joins to form the portal vein behind the neck of pancreas. So these are the important relations of pancreas to be noted. Then let's see some MCQs. Structure immediately posterior to the pancreatic head. I hope you know the answer. Right renal vein, splenic artery, left mesenteric vein and celiac trunk. So obviously the answer is right. So we see right and left renal veins which drain into inferior vena cava lie behind the head of the pancreas. Remember that. So right renal vein is the answer. Right and left renal veins drain into inferior vena cava behind the head of the pancreas. Next is the neck of the pancreas is related to its posterior surface. Just now I said it's very important. So the answers here, let's see the options. Gastroduodenal artery, superior mesenteric artery, inferior vena cava, bile duct. So bile duct we know it is related to the head of the pancreas. Superior mesenteric vein joins with the splenic vein behind the neck of the pancreas to form portal vein. So the answer is superior mesenteric vein is the answer. Gastroduodenal artery lies behind the first part of the duodenum and the head of the pancreas. So this may produce a severe hemorrhage or posterior perforations of duodenal ulcers. That is one thing to be noted about gastroduodenal artery. And next about the inferior vena cava and bile duct lie behind the head of the pancreas. So carcinoma of the head of the pancreas can compress this inferior vena cava and bile duct leading to obstructive jaundice. So those are the points can be noted with the other options. So this completes the pancreas along with its clinical aspect. Thank you.